Strong, healthy teeth and gums are the key to a high quality of life. Unfortunately, most people start thinking about this issue too late. Nowadays, people with truly healthy teeth are quite rare. Poor nutrition, stress, lack of sleep, and a weakened immune system all have a negative impact on dental health. How can you keep your teeth healthy into old age? A person with a beautiful smile naturally inspires trust. However, the older we get, the more attention we need to pay to our dental health. Below are several useful tips that will help you preserve a bright, healthy smile. If plaque is not removed thoroughly, it accumulates and turns into tartar, a hard structure that constantly puts pressure on the teeth and gums. Tartar is extremely dangerous for oral health and can lead to tooth loss. Thorough daily oral hygiene. Most people learn in childhood that teeth should be brushed in the morning and evening. However, even in adulthood, not everyone practices oral hygiene consciously or follows proper brushing techniques. It's not just about the 2-minute rule, although brushing should last at least that long. Brush movements should always go from the base of the tooth toward the cutting edge, with the bristles positioned at a 45-degree angle to the tooth surface. Do not press too hard on the brush, as this can damage the enamel and gums. Horizontal brushing movements can push food particles into the spaces between teeth, where they gradually destroy the tooth structure. If you have braces or other dental appliances, or if certain areas are difficult to clean, it is recommended to use a single-tuft, mono-tuft brush in addition to a regular brush toothbrush. It is also important to clean not only your teeth, but your tongue and gums, as microorganisms live throughout the entire oral cavity. High-quality toothpaste. Not all toothpastes are the same. Toothpaste should be selected individually, taking into account the condition of the enamel and gums. For example, one patient may be advised to use toothpaste for sensitive teeth, while another may need one containing calcium, fluoride, or phosphorus to strengthen the enamel structure. Why is it important to follow these recommendations? Because if, for instance, your gums bleed slightly and are not strengthened with a special toothpaste, or worse, if you use an abrasive toothpaste, the condition can worsen and eventually require professional periodontal treatment. Oral care after every meal. Ideally, a mouthwash should become as essential an item in your bag as a bank card. Rinsing your mouth after every meal is recommended, as this is the only way to fully protect the oral cavity from microorganisms. Today, there are mouthwashes with different compositions and purposes, preventing gum inflammation, protecting teeth from cavities, and freshening breath. Your dentist can help you choose the one that is right for you. Observing hygiene standards. Each person has their own unique oral microflora, so it is best for family members' toothbrushes to be stored in separate cups, or at least in individual cases. Bacteria spread easily in a moist environment, so if toothbrushes touch each other with their bristles in the same cup, they will exchange microorganisms, which then enter the mouth during brushing, and can trigger unpleasant processes. A toothbrush should be replaced at least once every 3 months, and must be thoroughly dried after each use. It is also recommended to replace your toothbrush after you have had a cold or any viral or bacterial illness. Using dental floss. Dental floss is one of the most important tools for maintaining healthy teeth. Even a well-chosen, high-quality brush toothbrush cannot properly clean the spaces between teeth. Choosing the right floss is also essential. There are 3 main types: flat, tape, and round. Flat floss is suitable for cleaning tight interdental spaces and is optimal for crowded teeth. Round floss is recommended for people with wider spaces between teeth. Tape floss is used in cases of cosmetic defects in the position of incisors or when there are significant gaps between other teeth. One important nuance: if your gums bleed, it is better not to use dental floss until the gum problem is resolved. Otherwise, flossing may provoke inflammatory processes. The rules for flossing are simple. Start with the upper jaw, insert the floss into the interdental space, and gently move it toward the gum using repeated back and forth motion. Proper, balanced nutrition. Do not forget that the condition of your teeth directly reflects your immune system and overall health. Therefore, it is extremely important to maintain general health, eat a balanced diet, and replenish essential trace elements, especially fluoride and calcium. These elements help make teeth stronger and healthier. Dairy products, meat and fish, eggs, greens, nuts, as well as hard fruits and vegetables should be a constant part of your diet, limiting sugar and acids. Sugar and acids are the most harmful substances for teeth. Toffees, hard candies, caramels, and similar products create ideal conditions for bacterial growth. However, it's not only sweets that damage teeth. Common beverages can be harmful as well. Coffee and tea contribute to tooth discoloration, while packaged juices and carbonated drinks erode tooth enamel. It is advisable to reduce consumption of these drinks as much as possible, and if you do drink them, do so slowly through a straw, and be sure to rinse your mouth afterward. Fluoride plays an important role in preventing cavities by strengthening tooth enamel and reducing its susceptibility to acid attacks. Use toothpastes and mouthwashes containing fluoride. Fluoride helps restore the mineral composition of enamel and prevents the formation of cavities. Harmful habits and other risks. Certain habits can negatively affect dental health. Smoking and alcohol consumption are among the main factors contributing to oral diseases. Nicotine and alcohol destroy tooth enamel, cause gum inflammation, and can lead to tooth loss. Giving up these harmful habits significantly improves the condition of teeth and gums. Avoid the habit of chewing hard objects, such as pencils or fingernails. This can cause micro cracks in the enamel and damage the teeth. Also, do not use your teeth to open bottles or packages, as this can lead to chips and cracks. Make sure you do not grind your teeth, especially during sleep. Bruxism, involuntary teeth grinding, can cause significant enamel wear and lead to problems with the jaw joint. If necessary, use special mouth guards to protect your teeth from damage. Consult your dentist about the need for fluoride-containing products. In some cases, the use of special fluoride gels or varnishes applied directly to the teeth may be recommended for additional protection. Pay attention to the fluoride content of the water you drink. In some regions, water may contain insufficient fluoride, requiring additional measures to ensure adequate intake. Regular use of fluoride-containing products helps maintain dental health and prevent cavities. If you want to keep your teeth healthy into old age, your dentist is your main ally. Prevention is more cost-effective than any treatment, especially if neglect leads to the need for implants or other prosthetics. It is recommended to visit the dentist twice a year for checkups and to undergo professional dental cleaning at least once a year. These simple, routine actions help reduce the risk of cavities and preserve dental health for many years. There is no need to fear dental visits. Modern dentistry is very different from what it was 20 years ago. Clinics are equipped with everything needed for patient comfort, and even if treatment is required, it is usually painless. To keep your teeth healthy for as long as possible, follow these rules. Drink high-quality water, provide your body with sufficient vitamins and beneficial trace elements, eat a balanced diet, perform gum massage, give up harmful habits, use products that strengthen enamel, visit your dentist regularly. Oral care must be consistent. You cannot do it only from time to time, otherwise you risk developing numerous problems. Your lifestyle also affects dental health. Stress levels, sleep patterns, diet, smoking, alcohol consumption, and many other factors. If you know that you are prone to tooth decay, it is especially important not to neglect basic oral care procedures. This will help you postpone fillings and dental implants for many years.